So in this video, we are going to demonstrate the dissection of neck region. To orient yourself to this specimen, this is the head region, this is clavicle, this is arm. Okay, so we are showing here the left side of the neck region, which is associated with triangles. So we do dissection, you encounter certain structures. So this is the skin. So after skin, you get superficial fascia. You can see the superficial fascia. In the neck region, we get this thin muscle in the superficial fascia called as platysma. So I'm reflecting platysma. I cut from the origin side, reflecting it here. So you can see here a big muscle, which is a landmark for this neck region, called sternocleidomastoid. Starts from the sternum, clavicle, and gets inserted onto the mastoid process mainly. Now you can see a small vein here which is running over the sternocleidomastoid muscle. This is external jugular vein. So I'm reflecting it. Now this sternocleidomastoid muscle divides the side of the neck region into two main triangles. Anterior triangle, anterior to the muscle, posterior triangle, posterior to it. Okay, so this is the posterior triangle, which will have roof, floor, and main contents. Okay. So, talking about the posterior triangle, you can see this small muscle, inferior belly of omohyoid, which starts from the scapula and goes towards the hyoid bone, divides the triangle further into two smaller triangles. So the triangle above the omohyoid is occipital triangle. Okay. So here these are cutaneous nerves. These are the muscles forming the floor. This is splenius capitis, levator scapulae. This one is scalenus medius and scalenus anterior. So I'll just show the main contents here. This is the spinal accessory nerve, which pierces this muscle, lies in the triangle, and then it supplies the trapezius, or the muscle, trapezius muscle. Then apart from the spinal accessory nerves, we have these cutaneous nerves present in the occipital triangle and an occipital artery at the apex, which has not been exposed yet. The other division of occipital triangle, posterior triangle is subclavian triangle or supraclavicular triangle, which is bounded by sternocleidomastoid anteriorly, inferior belly of omohyoid, and a clavicle. Now, as a content, we have trunks of brachial plexus. This is upper, middle, and lower. This is subclavian artery and subclavian vein. Okay, so this one is subclavian vein. So these are the contents of subclavian triangle. These are the contents of posterior triangle. Talking about the anterior triangle, which is bounded by anterior midline, the base of the mandible, the imaginary line joining to the mastoid process from the angle of the mandible, sternocleidomastoid muscle. Okay, so this is the anterior triangle, which is subdivided into further 3.5 triangles by two muscles. So you can see this is digastric muscle. Why it is called digastric? It has two bellies, anterior belly and a posterior belly. Okay, then the superior belly of omohyoid. So these two muscles divide the triangle into anterior triangle into and digastric triangle between the two bellies, carotid triangle between the superior belly of omohyoid and the sternocleidomastoid. This one is muscular triangle, and you can see the small submental triangle. So this is only one triangle, unpaired triangle. The rest all triangles are paired triangles. You will find one on each side. So talking about the digastric triangle, the base is formed by the lower border of the mandible, angle of the mandible, and imaginary line. Anteriorly we have anterior belly, posteriorly posterior belly associated with a small one more muscle, stylohyoid muscle. Okay, so we will divide the contents in the anterior part of the triangle and posterior part of the triangle. The main content of this anterior part is submandibular gland. Then you can see the small node-like structure. This is lymph node. Then we have facial artery, facial vein, and these are submental mylohyoid vessels. Okay? So these are the contents of anterior part. Posteriorly, we have content as a continuation of external carotid artery, internal carotid artery, the styloid process, and three muscles associated with the styloid process, that is styloglossus, stylopharyngeus, and stylohyoid muscle. Also, the lower part of the parotid gland also forms a content in the posterior part. So this is the digastric triangle. Now, this is your carotid triangle. The carotid triangle is named because of its content, three main arteries: the common carotid, external carotid, and internal carotid artery. So roof is formed by the skin, superficial fascia, platysma, cutaneous vessels and nerves. The floor is formed by certain muscles which are not seen here. For example, hyoglossus, middle constrictor, inferior constrictor, and thyroid muscle. Contents you can see here. This is common carotid artery. This one is external carotid artery. Now, how to differentiate external carotid artery from internal? Because it is the only artery, external carotid artery, which gives branches in this region. The internal carotid artery do not give any branches, doesn't give. It goes straight away into the cranial cavity. Okay. Then you can see this bluish big structure. This is internal jugular vein. Then one more structure here between the artery and the vein. This one is vagus nerve. Now all these structures are present in a carotid sheath, and embedded within the carotid sheath you can see this loop of nerve here. This one, this is called ansa cervicalis. This is superior root coming from the hypoglossal nerve. This is inferior root, and from here it gives branches and supply all these infrahyoid muscles. Okay, so in this case the loop is short and then it gives a big trunk, and from that we are getting now supply for this infrahyoid muscle. So carotid sheath, anterior wall, it is embedded. It is not a content, it is embedded within the anterior wall. But as a content you will have common carotid, internal carotid artery, internal jugular vein, and the vagus nerve. Now I would like to show one more structure which is not part of the carotid sheath, but it is present posterior to the carotid sheath. Now you can see this structure. This is called sympathetic chain. Okay, so you can see here the middle cervical ganglion is also associated with it. So this is sympathetic chain, this is carotid sheath, and this one is vagus nerve. How will you differentiate? The vagus nerve is uniform in structure, but this sympathetic chain, it shows one elevation as a ganglion here, and it is very easy to identify carotid sheath because ansa cervicalis, it forms loop. Now in this case, if you observe here, the internal carotid artery is showing variation. It is not going straight away, it is showing a loop. Okay, it is forming a bend here. It can be associated with neurovascular disorders. So many variations have been recorded. So it is not going straight. Can you see here? This is forming a loop here. Okay. Now there are 5 branches of the external carotid artery in the carotid triangle. The first one, this is called superior thyroid artery, which is going to the thyroid gland. Then you can see this artery which forms the characteristic loop. Okay, this is lingual artery, and above that you find the facial artery. The facial artery has got cervical course and then the facial course. So from the anterior aspect, the external carotid artery gives 3 branches: superior thyroid artery, lingual artery, and facial artery. Opposite to the facial artery, you can see one more branch goes towards the posterior triangle. This is occipital artery, and the 5th branch, which is not seen here, is ascending pharyngeal artery. So in total it gives 5 branches in the carotid triangle. You can see one nerve here. This is called superior laryngeal nerve, which divides into external laryngeal and internal laryngeal nerve. So these are also contents of carotid sheath. Now while doing dissection, we got so many lymph nodes associated with the internal jugular vein. They are also content of carotid triangle. Now this small triangle is submental triangle, which is present just below the chin, bounded by anterior bellies of both the sides. The base is formed by the hyoid bone. The floor is formed by the mylohyoid muscle. The roof is again skin, superficial fascia, platysma, and contents are not much. We have submental vessels and the lymph nodes and the beginning of anterior jugular vein. The last triangle we can see here is the muscular triangle, which is bounded by superior belly of omohyoid, lower part of the sternocleidomastoid muscle, and the anterior midline. Now we have, as it is named, muscular triangles. We have 4 muscles arranged in 2 layers. The first layer, superficial layer, we have sternohyoid muscle, and the next muscle is superior belly of omohyoid. Then deeper down we have 2 more muscles, starting from the sternum to the thyroid, sternothyroid muscle, and from thyroid to hyoid, thyrohyoid muscles. So these are the muscles present in the muscular triangle, which are supplied by ansa cervicalis.